Welcome back to the Dream Room, where we explore the minds and hearts of people who have turned their passion into purpose and their purpose into impact. Today's guest is a healer, an artist, and a surgical master of his craft. I'm honored to welcome Dr. Saied Malboubi, one of the most sought-after periodontists and implant surgeons in the San Francisco Bay Area. Dr. Malboubi holds a Doctor of Dental Surgery from Boston University, a Master's in Oral Biology, and an Advanced Certificate in Periodontics and Implant Surgery. He's served as a clinical assistant professor at University of California, San Francisco, and treats patients from across the country who come to him not just for his expertise, but for his vision, integrity, and incredible results. Welcome to the Dream Room, Dr. Malboubi.
Thank you very much, Amytra. I'm so happy to be with you. Thank you for taking time to come over, and thank you for introducing me.
Oh, of course. Let's go back to the beginning. When did you first realize that the mouth, the smile, the face was going to be your life's canvas?
Well, that's a very nice way to put it together. I like your wording. Actually, I think the first time I was thinking to be a surgeon or any kind of healer, as you say, I was about like 5 or 6 years old. All my mother's side of the family are doctors, so my mom's brother. And I always liked the way he was so passionate about himself and about the work. And then sometimes I follow him to the hospitals, and I was saying how much he gives to people. Mm-hmm. And the effect and the impact he puts on the people, that was so impressive. So unconsciously, I got my decision in very early ages. Mm-hmm. And it's so interesting that when you grow up and as an adult, how your unconscious lead you to follow your childhood dream even before you know it. None of my parents were in medical. I was the first in the family, the whole family, to pursue medical and then pursue more and more. And then when I came to this country, to Northern America, I just did another step in Boston University. Mm-hmm. I have been practicing back in the Middle East. I also in Europe. I'm holding the license and was practicing, and this is the third continent.
Wow!
I holding a license for 20-something years. Yeah,
that's incredible.
And all this experience together, from different people, different cultures, different needs. I think that's my best asset now, to have my own way vision of, I don't call it dentistry. Mm-hmm. I call it oral medicine. Okay. That's what I put on that, because we don't look only on the teeth. Mm. We look you as a whole person, that your mouth and your teeth are part of it. But if you notice, most of my questions start from your whole body or systemic problems or your personality first also. Mm-hmm. We can change, a lot of time we change our treatment plans completely based on patient personality. Mm-hmm. And I can tell you, none of other sides of my life makes me happy when I see I can help another human. And when the tear comes to their eyes, a lot of joy comes to my heart because I made them happy. Oh, it's so satisfying. I tell my kids that this is a hard way to go. This is not easy to be a doctor, because it's hard to get there, and also you deal with person in this country. But it's definitely very, very satisfactory. Mm-hmm. It has a big satisfaction to be a healer, or as you say, or to be a doctor.
How is it different to practice here as compared to the Middle East or Europe?
Well, there are a lot of good and bad things. Mm-hmm. In comparison, you are more limited by a lot of laws and regulations, for sure. I have seen nowhere in the world there's the amount of regulations and limitations we have here. But at the same time, the power of technology, the power of innovations in this country is incredible. And anything happens, we know it first. We have it in hand first. And the economic power of this country makes us to have no limit to achieve our goals and to help patients. Mm-hmm. I can tell you for sure that what I personally have done in this country with the help of the power of mostly economy and the instrument and actually the whole power behind the whole industry, because it is, I couldn't do it other places. I'm the same person, same knowledge, but I really could do a lot of things that even I was thinking is not possible. I have videos, people crying here. There is a patient that we just finished it last year. He was in an accident 25 years ago, and here in this country, and very young, very handsome gentleman. And he's been told that he's not an implant case. So he's been wearing a denture. Imagine a 20 years old handsome guy, but the denture. He was telling that he was never date anybody, never. He was always shameful of the smile. And in the age of 39, he came to me through an orthodontist, which is a very good orthodontist also. And I did, with the power of this instrument and this industry, we made it happen. So we put his implants, we restored the teeth, and now he's like, he tells that's the life-changing experience. Life-changing experience, yeah. A lot of them. I mean, like at least a couple a year. Yeah.
Now, you've also taught others, future dentists, yes?
That's right, yes.
But I imagine your patients have taught you things too?
Of course, every day. I always tell that. I always tell to my students that when you get to my age and after some 20-some years of experience, you know what you learn from people, even for your own profession, the way it changed your vision. That's something, it's so hard to teach people. The experience you get from the patients, from the human touch, from the human connection, it's not teachable.
It's not in a textbook.
It's not in a textbook. No, I mean, sometimes the teachers tell us these things and we don't get it. We don't feel it until we experience it. So when you experience that kind of things between you and your patients as a two human beings that try to help each other, well, you think you try to help them, but unconsciously they help you a lot too. We learn a lot from people, yes.
So it sounds like you do more than fix teeth. You restore dignity.
Well, thank you very much for putting it that way. I think we not only heal the mouth and faces, we heal the spirits and souls. Honestly, people, it's so funny a story that when people come here by law, sometimes we scan the ID to have it. And the ID has a picture, right?
Yes.
So in the course of treatment, the patients sometimes change the IDs because it's expired. They go and change it and get the new picture. And we scan it again. And when we put these two pictures together, it's like somebody else.
Nice.
Their soul, I mean, they are happy. They are a completely different person. Yeah. And that's the most satisfaction I got.
That's beautiful. There's something spiritual about that.
It is, yeah. That's why this is my this place. My main office is kind of my temple. I really have peace on that.
Absolutely, and I can tell by the way you treat people.
That's right.
Because the audience should know I'm a patient.
Oh wow, yeah, that's right.
And that's beautiful. You were talking about advanced tools earlier. Lasers, PS. What is PSO?
Piezo is a kind of a very, very conservative knife. So in the old days, or still, a lot of places, when they want to cut the hard tissue, like a bone, they get a kind of drill that is very fine, but still is a drill, and it get away your bone. So when they cut it, you lose some bone. And also, there is a danger of cutting a nerve or an artery and make a disaster. And it happens that people who are in the industry, they know when they especially work in the lower jaw, there is a possibility of cutting a nerve and the patient is numb forever or life. This new technology, which is not new, but it's kind of new in dentistry, it's a kind of very conservative saw that never cut the soft tissue and never lose the bone. So this is, I can put it that this is a miniature way of doing surgery. So we call it minimally invasive or non-invasive techniques. So that's part of armamentarium for minimally invasive surgical procedure performance. And also laser, as you told, it plays a very big role in dentistry, especially in periodontics, which is the gum healing, the gum treatments. Different kind of laser we use, at least 3 kind here. It really revolutionized the whole treatments to be very conservative and very effective.
Yeah.
Yeah.
So let's go to the artistry of it. When you contour a gum line or place an implant, how are you seeing it? Are you seeing it like architecture or sculpture or?
Well, that's a very good question. Let me tell you that every dentist know one of the most famous books that the first year of dental school they make them to read, named Art and Science of Dentistry.
Art.
So now I can tell that this is as much as I know about medical in general, this is one of the very unique part of medical that you really have to have an artistic mind. You should have it. This is sometimes even hard to gain. It comes with, should be with you. So when you combine that art feeling with science that you learn, the combination comes something very powerful.
Yes.
So here it is. There is a famous say from Michelangelo. They ask him, how do you make such a beautiful sculptures? He tells, I don't make it. They are existing inside that stone. I just carved the extra.
That's so interesting.
So a good dentist, I think, that's what I look. I look at the face and I see that beautiful future.
Wow.
So I see this exists. I just have to carve the extra.
Yeah.
And when this comes after 6 months, 1 year, whatever, these 2 images matches, I see what I had in mind. Now I see it. That's so powerful.
That is powerful.
That's
I love
powerful.
it. Yeah. What do you carry into the room beyond your hands and knowledge that makes outcomes so unique? Like, how are you able to take a case where other people say, impossible?
Well, that's a hard question, but...
Has there ever been a case where you said, it's impossible?
Me? Yeah, there is always limitation to the knowledge. This is pretty much not impossible to give a treatment, but there are some limitations to the specific treatment. For example, if it's been... And let me tell you that, I always tell my student, after a while, after you learn everything, after you did all your experience, very, very important to know what not to touch, what not to do. That's also that's another art. People who we call it hero dentistry, never shouldn't do that. So you have to know that you are helping at the end. But what I take in the room, that's a good question. I think my passion, the good mixture of passion. You have to have a passion. You have to feel. That's what I feel. I feel this is me. I'm healing myself. I have that much passion for it. Or this is my dad or my mom, other people.
Yes.
It's the passion plus the vision together and your heart. It can really make the maximum outcome. When you are passionate about it, you have a vision out of experience and science, and then you get with your science together, it can make really, really, really good results and make it big satisfaction for you and for the patient.
So I know, even though you're passionate about it, it's your life's work, life happens. And has there ever been a moment when you felt you were burnt out or you I don't know if I can go on? Not that you were going to give it up, but like a tough moment where it was just hard. Yeah,
transient. I mean, sometimes happen. It never stays with me, thankfully.
How do you get through it?
Yeah, what happened, that's another thing I recommend to young dentists and young people, that when you get to I make, my word is hit the wall. I tell the student, when you hit the wall, don't try to hurt yourself because the wall not going to go away. That's a very simple solution. Stop. Get a couple step back. Give yourself time. A lot of time it happens. cases that it couldn't go forward. It stopped. And I tell the patient, I'm sorry, I'm not in the best mind. So I postpone it for maybe a month or two. And after a short vacation, beautiful, beautiful solution comes to your mind. It always happens. It's just a matter of time. Just a matter of time. So yeah, frustration is for everybody, especially every professional. This is a challenging job in general. My sister is also a dentist. And when she wanted to go to dental school, I told her something I made up, but I still believe on that. I told, listen, sweetheart, this is a freeway with no exit. Because the exit is so expensive and so heartbreaking. So when you go in, try to be sure. Yes. Because you invest a lot of time, mind, money, everything to be a good dentist. Make sure you like it. If you love it, you're going to love that road. There is no end to it. You just enjoy the ride. So this is stressful, but if you like it, I recommend, really, this is a good, very good profession. Very good. I'm so happy with it.
That's good.
And my kids, everybody see it on me. My kid asking me, how come you come home and you're not tired? I told, because I got my fuel in the office. Yeah. And I work, as you see, we're working long time here, long hours. I work sometimes 10 hours, 12 hours. I'm always the last person to leave the office. Always.
Wow.
I notice other people just leave the office and the staff are here. All the staff always tell me goodbye. I never tell them goodbye, you know.
That kind of brings me to my next question, because I noticed that other dentists I've seen where I don't really see them until there's something major to do. But with you, I've seen you since the beginning and then all the way through. Yeah. And that kind of care in these days feels kind of rare to me. So are you intentionally being that way, or is it just...
Well, to be honest with you, this is part of my OCD a little bit. I want to control every simple, small things. Not that I don't trust people. I have the best crew here. I love them. They are they're also so passionate about what they do. All of them, from front to the back. We have the best crew. Funny thing I'll tell you before I answer your question. During the COVID, pretty much everybody lost a lot of employees. That was the employee crisis. Yes. If you ask them, none of them left. I mean, it's been like 7-8 years. Nobody left this office. We only add people. So when I want to hire people, I look at to the eyes and I try to find the passion. If I see the passion for what we do, no matter what, I hire them. Because I believe the personality and passion exists, I can teach them the profession. Easy. Teaching is easy for me. But if the passion is not there, it's not going to fly long. So why I'm coming there all the time? Because I want to check everything. I want to make sure everything is right. Even the simple things. Let me see. Let me make sure. Or I teach them.
Well, the devil's in the details, right?
Yeah, exactly. I always tell them. We have a new employee and I always ask him, where is the devil? And he tells, in the details. Okay, perfect. Now you know.
Yes, and your staff is really happy. At least that's how it comes across, and you guys seem really close.
Yes, we really work as a team and a really family. The good thing is, I really don't feel like a boss, and they don't look at me like a boss.
No, it feels like a family when I come here.
Yeah, it's like a family.
Yeah.
You know? People, I don't even limit them to make jokes around each other or something. I try to let them to speak their mind very freely, honestly, yeah. This way, nobody get tired at the end of the day.
Yes.
People feel their second home.
No built up frustrations, no built up anything.
Nothing. So if you notice, I mean, American lifestyle, you see your colleagues more than your family. You know, like
absolutely.
8-9 hours, the productive hours of your mind, you're at work. So people who work with you, they are more in contact with you than your family. You go home, you maybe get something a little bit and then rest. So you come back home again. This is what makes America, right?
Right.
working.
Yes, capitalism.
Yes, I know. But if you make the workplace a happy place, why not?
Absolutely.
Yeah, you want to work then.
Yes, I think your most powerful tool is your perspective.
Yes, thank you.
Very well.
Shit.
What belief or mindset has served you most in your career?
Well, I have one sentence I made it for myself, and I try to not teach, but I always tell my kids. I have a 17 years old and a 12 years old, and I try to transfer my vision. I tell them that I made it for myself. I tell humankind, all of us, we can never be happy unless we realize it's impossible to be happy alone. So they have to realize that helping people, you are helping yourself by helping people, because it gives you a feeling that nothing else giving to you. So that's my major push every morning. I know there is a huge joy and huge blessing in helping people.
Oh, yes. Yes.
And that's why I'm happy with this profession, because it gives me opportunity to help people directly, very directly, firsthand. In the other jobs, you can also, of course, everybody help each other, but sometimes you help indirectly. You make nice banking system. You may help everybody. But when you help somebody directly and heal and release the pain or unhappiness directly, that's so powerful.
That's so powerful.
Yeah.
If you weren't a dentist, if this version of you didn't exist, who or what would you be, do you think?
Well, my older daughter thinks that I can be an amazing social worker.
Yeah.
Yeah, because she's very into it, very into sociology and social working and helping and that kind of things. She does a lot of amazing things. I'm so proud of her. And when we discuss things, she thinks I can be big role social helper or social worker, because I love to interact with people.
What a compliment coming from your daughter.
Yeah. I mean, yeah, they speak their mind, but anything that be in touch directly with the humans and try to help them, try to make the quality of life better for them in any aspect. Now I'm in the healing aspect of the medical. It could be from psychological or social stats, anything. One of the biggest motivation I have to keep engaging in academia and teaching is that I love that human connection.
So are you still teaching?
At this point after COVID, I slowed down because I put a lot of pressure on this office, but I'm going to start again this next semester, yes. But we have a lot of private teaching. I get invited by CDA. I just got invited by California Dental Association for next April. But small societies, group of dentists, they find us and find me. Then they get an invitation. Me and my good assistant go there and put a nice lecture for them. Yeah, I'm involved in teaching all the time. But in the university, academia, I was, and I could do it again. But in private sessions and also state level, yes, I am. Yeah, very much.
Speaking of state level, I heard you're an internationally ranked table tennis player. How does that work? When do you find time to do that?
Well, it's so funny. Did I tell you the story?
No.
I just came. I came to California like about 15 years ago, almost. And my whole education was in Boston. I mean, specialty wise, and I was playing for BU Medical all these years. BU Medical as a head of table tennis team. I liked that, and I was playing okay at that time. And because of that ranking, it went to internet all the time. My name. So when I came here, and people who come to that offices that I work, they want to try to see who is this guy, because they never knew that. So they search my name and comes as a tennis player, and they were thinking somebody else. So they were coming to me and tell, "Oh, doc, do you know there is another person, exact same name, tennis player?" I told, a table tennis player. I told, "Yeah, I heard about it. I know there's somebody else." I wouldn't bother to explain. But yeah, I mean, in general, I love the sports, and we got from our dad. My dad was his main job when he was young was to create stadiums.
Create stadiums?
Yes, he contract the stadium to make all the sport part, like the facilities, metal facilities for football, volleyball, basketball, anything. And he was playing a lot of sports, and he was extremely pushing us and encouraging us to play different kind of sports. He never gave us any time to do anything other than studying all the sports. And I'm really happy about what he did. I try to do the same thing with my kids. But table tennis was the main thing I was doing with my brother. He's also very good.
Sounds like you enjoy it very much. And you're a little bit competitive, your ranking.
Yes. I had the international ranking, still has.
So what is something about your profession that no one ever asks you or no one ever talks about that you think deserves more attention?
In general, people think, or they have an imagination, that dentistry or dentist is a fancy job. It's not. It's very body and mind consuming. I don't want to tell anything negative, but if you do the research, you see the top 3 data of suicide in medicals. One of them, dentists, all the time.
I'm glad you brought that up.
Yeah, they used to be number 1. Number 1 suicide in medical professions was dentists. And it shows a lot of pressure in minds, because this is part of the medical professions, one of the medical professions, that your patient is awake 100%. You are cutting the gum or you're drilling to the tooth while the patient is only numb, but the feeling, and head and neck in general has a lot of nerves, and it's connected close to the brain. So when the patient gets any small piece of anxiety, because he's awake or she's awake, 100% transferred to the operator. So it has nobody even asks us,
if you're in pain, the dentist is too. Emotionally, psychologically, so feeling responsible.
Nobody knows that how much back anxiety goes to the dentists when they're working. They think, oh, that's so fancy. They are expensive people. No, I'll go that way. But I'm telling you, this is a very body and mind consuming profession.
So how do you deal with that?
The challenging part of it, plus the passion, I'm telling you. And I think you ask every dentist, they tell you the same thing. When you have a passion for it, the challenge comes soothing.
The challenge comes
soothing and make you happy. I can tell you that. Imagine a sport champion. Is it easy to run 200 yards in like 2 minutes? No. How can they do it? How? And how they keep doing it?
They want it so bad they don't stop trying.
Yeah, exactly. It's not a matter of money or nothing. Not even fame. There is a passion. That runner or that champion want to prove to himself that I can do it. I can do it. Now, you put this challenge and passion with the gift of feeling of helping another human together. So a lot of time patient comes and tell, doctor, I'm happy with it. And I tell, no, I can make it better for you. I can make it more happy. So the passion and the human touch and human feeling together, it's a very good push for, I think so. That's on me, but I think most of the dentists going to tell you the same thing.
Yes, it's important to talk about every aspect. I'm so glad you brought that up.
You are so smart of the questions. I really like that. Nobody ever asked me that one.
Wonderful.
A lot of them.
I try.
Very smart choice.
Dr. Malboubi, it's clear that your dream isn't just about dentistry. It's about restoring people to themselves. You bring your full self into the room, your hands, your heart, your training, and your intuition. Thank you for showing us what it means to be both a master and a healer.
Thank you very much for coming, and appreciate your thoughts. As I told you, are a very smart person who have these questions, even if you don't know the dentistry, but you have a different vision. I like that.
Yes, thank you. So if people want to get a hold of you for dental work or speaking engagements, how do they do that?
We are running a center in Oakland, close to San Francisco, named Oakland Dental Implant Center. You can easily Google it. And yeah, that's the easiest way to get hold of us. Of course, I don't want to give a phone number, but you can find it easy.
Okay.
Oakland Dental Implant Center in Oakland.
All right.
That's easy to find us. And you just put my name, Saied Malboubi, and I think that a lot of Google things come up a lot. Yeah.
Maybe they'll see you playing tennis too.
Yes, and I recently, in the last 2 years, I was playing table tennis and tennis, and now I started playing pickleball. And I grow so fast because I knew the other two. So me and my younger daughter, I try to push her to be in the tournament level and competitive level. So
wow, cool.
So anything come to the rocket, I'm a big fan.
Yeah, you got to keep them kids busy. I know that. To anyone listening, if you've ever felt self-conscious about your smile or fearful of surgery or unsure if your case is too far gone, know that there are people like Dr. Malboubi who see your wholeness even before the healing begins. You can find him at the Oakland Dental Implant Center, as he said, and if you've been looking for a sign to reclaim your confidence, this is it. Thank you for dreaming with us. Until next time, I'm Amytra, and this is The Dream Room.